Welcome to AAMG channel. Today we are very honored to have our AAMG doctors, internal medicine. Welcome, Dr. Chang.
Hi, Esther. Thank you for your invitation.
You're welcome. And we'd like to ask, what topic would you like to introduce to our audience?
Well, we're going to talk about a very popular topic today, which is dementia.
Can you actually tell us about why this topic is important to our audience?
Sure, yeah. Dementia is very widespread problem nowadays. Just by the estimation, it's about like 35 million of people in America suffering from dementia nowadays. And there's a projection saying that by year 2050, that will be like even more than 2 times people suffer from dementia. That's why we try to concentrate on this topic today and let everybody know about what's causing dementia and what is the prevention of dementia and what are the symptoms we expect from dementia. Let's start off with some interesting photos before we start more complicated description here. Okay, the first photo, we see a very beautiful lady here. Anyone recognize who she is? Okay, you may be right. She is the Prime Minister of United Kingdom, but unfortunately, she already passed away. She was the Prime Minister of UK from 1979 to 1990. Okay, if you missed the first one, I'm sure you recognize this second person here. He is the great president of USA before, and his name is Ronald Reagan. Okay, here comes the Chinese guy. His name is Professor Kao. He was the professor of Chinese University in Hong Kong. And what is the famous about him? He was the winner of Nobel Prize in 2009. He got a reward on physics for that particular Nobel Prize. The reason for that is because he had a great contribution to the fiber optic material, and that is the pioneer of our internet nowadays. So all 3 persons are very famous, and what are in common of them is they all suffer from dementia towards the end of their life. That's very unfortunate. So today I'm going to talk about dementia. Basically, dementia is a disease caused by abnormal changes of the brain cells. The changes, unfortunately, trigger a decline in our brain function a lot. We have different names for dementia in Chinese, in different places like Hong Kong, Taiwan, and China. But in English, it's very simple. We all name it as dementia. How big is the problem, actually? Well, as I mentioned earlier on, there are about 50 million of people suffer from dementia. And by 2050, which is like 30 years later, there will be like 135 million people, much more people will suffer from dementia. The next question you have in mind may be why? Why is that? Medicine is supposed to be getting better. Why we're going backward? We get more people suffer from dementia by that time. Yes, you are partially right, because we are doing great in terms of our medication, in terms of our technology, and people can live longer nowadays. But that is the problem of that, because when people getting older and they get dementia easier. Okay, as you can see the little table there, from 65 to 74 years old, is only about 3% of people has dementia. From 75 to 84, the chance of getting dementia is higher, is 19%. If you're over 85, you got about 1/4 of the chance to get dementia. Is that scary? Yeah, it's getting more scary. When you get older, you try to enjoy your life more, but you may get a disease like dementia that you cannot enjoy your life anymore. And there are some more observation, from the medical point of view, we have noticed the female patients tends to get the dementia more than the male patients. As the same reason, as I mentioned before, because female they live longer than male in general. So they get a higher chance to get dementia. And also in low and middle income countries, they tend to have more people suffer from dementia. And I will explain the reason behind later on. When we talk about dementia, there are many different types of dementia. And we're going to concentrate on one single type named as Alzheimer's dementia. Alzheimer's disease has about 70% of the total number of dementia cases. It was first described by a German doctor named as Dr. Alzheimer. And he's the first one to name about this disease. And as you can see on the slide here, the one on the left, well, first of all, this is a cross-section of our human brain. It's a simplified one. And the first one on the left, you can see a normal brain. It looks very full and complete. But the one on the right, you can tell it's small in general. The size of the brain compared to the left is much smaller. And it looks like, particularly in certain areas, there are some shrinkage. Instead, one on the left lower corner, if you have good eyes, you can see that is the hippocampus area. And we can talk about that area later on. So, just looking at this cross-section of the human brain, when they do the autopsy, you can see the difference of people with dementia, and the brain definitely looks abnormal. We talk about most, common type of dementia, Alzheimer, and the second most common dementia is vascular dementia. I have a lot of patients who suffer from stroke before. After the first stroke, they are fine, except they might have a little bit of weakness on one side of the body, but they still functioning well. Their brain, has very intelligent mentality, and they can respond to questions really fast and very effectively. But unfortunately, if they have like a second stroke or first stroke, and then, you can tell that cognitive function actually decline rapidly. In some cases, because they are suffering from a type called as vascular dementia. The people who have multiple stroke in their life, and they might suffer from vascular dementia. And this category contribute about 25% of the total number of dementia patients. And then, we have some other much rare dementia type, such as dementia with Lewy bodies and frontal temporal dementia. And there's a whole long list at the next page. Okay, we have dementia caused by normal pressure hydrocephalus, Parkinson's disease. We have dementia caused by STD, including syphilis, HIV. Of course, people with family history of dementia, they have a high tendency to get dementia. And something, we need to pay more attention is in certain patients, they have deficiency in some kind of vitamin and they get dementia too. So we have to make sure, when we seeing the patient with symptoms of dementia, we have to check, whether they have any vitamin B deficiency. And brain tumor, of course, if somebody get a brain tumor growing in the brain, they might get into dementia. Low function of thyroid gland, not getting enough secretion of thyroxine, they get dementia too. Heavy alcohol user, they might suffer from dementia when they have drink enough for years and years. Metal poisoning, and there are two more on the right column here, as you can see. Chronic hypoxia. I want to expand a little bit about chronic hypoxia. That means, we are not getting enough oxygen all the time. One condition we have to pay more attention is, we call it sleep apnea. A lot of people, they might have sleep apnea and they stop breathing in the middle of the night and they don't even know it. And if they suffer from long enough of time, they might have dementia. So we have to be careful. So if you have a lot of loud snoring, or your spouse notice that you might have a very noisy snoring at nighttime when you sleep, or you might have noticed that you stop breathing in the middle of the night, then you better tell your doctors. So the doctors can do some tests, make sure you don't have like sleep apnea. And the last category is traumatic brain injury, such as, people playing like football, boxing, and that increased chance of getting chronic brain trauma, and that can end up with dementia too. So those are the really rare causes. And as I said, the major cause is Alzheimer's disease and vascular dementia.
Thank you so much, Dr. Chang, for sharing this valuable information on the topic of dementia and also giving us some secret tips to prevent dementia as well. If you like this video, please share and like, and most importantly, subscribe our channel.